Has someone you love begun to show subtle but worrying changes over the past year? Many people assume that death and old age happens suddenly, but the reality is that there can often be silent warnings, sometimes months or even a year before life enters its final stages. The problem is that most people ignore these signs because they seem small at first. It is only in retrospect that families realize that the termites were there all along, but by then it is too late to prepare, too late to create meaningful final memories. In this video, we will talk about the 5 main signs that often appear a year before an elderly person passes away. Some of these may be things you've noticed, but dismissed as aging, while others may be subtle changes that are actually signs of your body's gradual decline. Catching these signs early gives you the opportunity to provide better care, cherish meaningful moments of resolution, and most importantly, ensure your loved one's final years are filled with comfort, value, and peace. Please come back for our final video, as these signs can help prepare you emotionally and practically for what is to come. Once you understand what is happening, you will have no surprises and you will be able to make the most of the time you have left with the people you love. Time to get started. Number 1. Significant weight loss. One of the first and most obvious signs that a person may be approaching their senior years is unintentional weight loss. At first, it may be just small changes. Belts need to be tighter, clothes become looser, or they no longer fit as well as they used to. Many families consider it just a part of the aging process, but the reality is that unintentional weight loss is often not a good sign. It often indicates that the body is no longer absorbing nutrients effectively, muscle mass is starting to decrease, and essential systems are gradually slowing down. Natural aging leads to some fundamental losses, but when it happens too quickly, it's a sign that something deeper is going on. The body may be having trouble digesting food, or the person may not be able to process the resulting protein efficiently, leading to muscle loss. This loss of strength not only makes movement more difficult, but also increases the risk of falling, weakens the immune system, and leaves the person vulnerable to infection. Another reason for weight loss in the last year of life is a change in sensory perception. Many older people simply do not feel as hungry as they used to. Sensory perception fades, food becomes less appealing, and they may start skipping meals or eating very little. This is not just a matter of habit, but a biological change, as the body can notice that it is starting to shut down and no longer has the signal because there is no food-seeking machinery as before. The result is less energy, less strength, and overall health. And then there's the role of underlying medical conditions. Weight loss is a common symptom of chronic diseases like cancer, heart failure, or kidney disease, all of which can begin to develop before advanced symptoms appear. Even depression or cognitive decline can lead to reduced eating, creating a downward cycle where the body doesn't have enough fuel to sustain itself. Some families try to address the problem by encouraging their loved one to eat more, offering favorite foods or supplementing meals with protein-rich foods. But if weight loss continues despite these efforts, it is important to realize that the problem is not just diet, but that the body is preparing for a more profound transformation. At this stage, forcing yourself to eat large meals may not help. Instead, focusing on foods that are easy to eat, comfortable, and maintain your diet can make a bigger difference in maintaining your quality of life. If you notice your loved one losing a significant amount of weight, especially if they are eating less, feeling weaker, or having difficulty staying active, it is time to take notice. It's not just a matter of appearance, but the foundation is sending a message, and being able to understand this message now can help prepare you for the road ahead with clarity, compassion, and the ability to make each remaining moment meaningful. Number 2. Extreme fatigue and weakness. One of the most noticeable changes in the last year of life is a deep and constant fatigue that does not go away with rest. It is not just a relaxing tiredness after a long day, but a profound exhaustion that makes even simple tasks seem overwhelming. Getting out of bed becomes a challenge. Walking across a room requires effort, and activities that were once considered routine, such as cooking, dressing, or even talking, begin to tire. This is not simply a result of aging, but a sign that the body is conserving energy, but that organ function is starting again. The body can start what is most essential. The heart doesn't pump as efficiently as it used to, blood flow slows down, and muscles don't get as much oxygen as they used to. This is why many older people feel weak, unsteady, and unable to maintain the same level of activity as they did in their last months. Another major factor is a slowing of the metabolism. The body may be designed to produce and use energy, but as it prepares for the final stages, this energy is diverted. Instead of fueling movement, it may go to maintenance. This is why a person in decline may start to sleep more, needing longer sleep periods during the day, and having more difficulty staying awake for long periods of time. Some people even experience a pulsating energy slump, where they can settle down for a while, but then feel exhausted the next. But perhaps the most painful part of this process is the emotional impact of fatigue. Many older people who once prided themselves on their independence begin to feel frustrated or even ashamed that they can't do what they used to do. They may withdraw from conversations, avoid social interactions, or stop participating in hobbies not because they don't care, but because they simply don't have enough energy. This can lead to a cycle of isolation. As they continue to push themselves too hard, this only accelerates the decline. For families, watching a loved one go from being active and engaged to being tired and therefore alone can be very painful. It's easy to assume they're just lazy or need to get over it, but the reality is that forcing activity won't help. The most important thing is to understand their limits, allow them to rest when they need it, and make the rest of their days as comfortable as possible. If you notice you're experiencing deep and constant fatigue that doesn't go away with rest, take it as a sign that their body is going through a larger transition. This is a time to be mindful of conversations, create reassuring moments, and support them without expectations. Because in the end, what matters most is not how much they can do, but that they feel loved, understood, and at peace. Number 3, confusion or withdrawal. As a person approaches the end of life, one of the most dramatic changes can be found in the way they think, communicate, and interact with others. You may notice that a person who was previously quick-witted and engaged begins to forget things more, have difficulty following conversations, or seem disoriented in familiar places. They may repeat themselves, forget names, or lose track of time, even if they had no previous memory problems. These subtle cognitive changes can occur months or even a year before death. This isn't just day-to-day forgetfulness. The brain, like any other organ, needs a steady flow of oxygen and nutrients to function properly. But as circulation weakens and oxygen supply to the brain decreases, cognitive function begins to decline. The person may become easily confused, have difficulty making decisions, or struggle to recognize people and places they've known for years. In some cases, they may even have periods of lucidity followed by sudden bouts of panic, almost as if their mind is fading and coming back to life. Another common sign is emotional withdrawal. A person nearing the end of life often loses interest in social interactions. You may notice them talking less, participating less, or spending time sitting quietly. It's not that they don't care about their loved ones. It's that they don't have the emotional processing and engagement skills to engage in the same way. Conversations become tiresome, noisy environments become stormy, and eventually, many seniors withdraw into their own worlds. You may also notice changes in mood and behavior. Some people become irritable, anxious, or easily distracted, while others may become unusually calm. Apathy or disinterest in things that were once important to them. This is not a personality change, but rather a result of not adjusting to physical decline. As cognitive function slows, emotions become more difficult to express, and the person may stop responding to problems the way they did before. For family members, this can be especially difficult, as watching a loved one lose touch with reality or withdraw emotionally can feel like losing them before they're actually gone. But it's important to remember that this isn't something they can control. Instead of trying to bring them back into conversations, the best thing you can do is meet them where they are, talk softly, offer safety, and understand that even if they don't respond, they can still feel your presence. Number 4. Frequent infections and slow healing. As your body begins to slow down, one of the most obvious signs is a weakened immune system. You may have noticed that someone who was previously sick now seems to have the flu, a cold, or other minor infections. Previously minor illnesses now take longer to heal. And simple wounds like a cut or a serious injury take longer to heal. These changes are not random. They are a sign that the body is not as able to protect and repair itself as before. One of the biggest problems is repeated infections. Infections, urinary tract infections, UTIs, skin infections. Even mouth infections become more common as the immune system weakens. Many families think these are just isolated illnesses, but when they occur frequently or take a long time to heal, they are often a sign that the body is losing its ability to fight off infections. Even antibiotics, which used to work quickly, may now become less effective. Patients may require stronger medications, longer recovery times, or multiple rounds of treatment for infections that were previously minor. This happens because as blood flow decreases and organ function declines, the body simply doesn't respond as well to treatments anymore. Another problem that comes to mind is chronic wounds. If you notice that a scrape, sore, or wound is not healing properly or keeps coming back, it could mean that blood circulation is impaired. Poor blood circulation means that oxygen and nutrients are not being delivered to the skin and tissues effectively, causing the healing process to take longer than normal. Pressure sores, especially for those who are sedentary, it becomes dangerous for the body to become fat and can lead to dangerous infections even if not carefully managed. What is more worrying is that the infections in the last year of life are often not what we expect. Instead of a high fever, older adults may simply feel more tired than usual, more confused, or less interested in eating. In fact, for older adults, a sudden decline in mental alertness is often the first warning sign of an infection, even before other symptoms appear. Therefore, recognizing these changes early can make a difference in the support and care they receive at the end of their life. For families, having an architect experience repeated outbreaks of infection can be very frustrating and heartbreaking. It's easy to hope that a round of antibiotics or a hospital stay will fix the problem, but at some point the goal often shifts from healing to making them more comfortable. Make sure they're hydrated, keep their skin clean and moisturized, and reduce stress so their body can do more for their health than a drug that prolongs the pain. Number 5. Major changes in breathing or weak completion. One of the most obvious signs that the base is preparing for the final stage is a clear change in breathing and circulation. You may notice that your person writes more slowly or more shallowly than before. Sometimes they may stop mid-breath or their breathing may become irregular, suddenly speeding up and slowing down. Some people experience a gentle, rhythmic breathing pattern called Cheyne-Stokes breathing, in which breathing alternates between deep and rapid breaths, then pauses for long periods of time. These changes may begin with, but over time, they will become more obvious and more frequent. Another common sign is poor circulation. You may notice that their hands, feet, or even their nose and ears feel cold to the touch. The skin may become pale, bluish, or alkaline, especially around the fingers and toes. This happens because the body is prioritizing blood flow to the vital organs, reducing circulation to the outer parts. This is a clear sign that the time is not as strong as before. Some people also experience more shortness of breath, even when not exercising much. Just sitting up, talking, or changing positions can make them feel tired or short of breath. You may notice them breathing out more or suddenly having to stop to catch their breath while talking. If they used to be able to walk easily, but now have trouble doing so, their breathing may be impaired. In some cases, fluid buildup in the airways can make breathing more difficult. This can cause a lingering, gurgling sound or a feeling of tightness. Many people assume this is just congestion from a cold, but for older people nearing the end of life, this is often a sign that breathing is becoming less efficient. This can make lying on your back uncomfortable, and you may prefer to sleep with pillows or in a recliner to help ease the breathing difficulties.